on you as a sports person, as a person in your daily life. It's moving right along nice and easy. So here's your view. You want to make sure the knees are lined up very nicely over the ankle, nice straight line from the front. From the back, you see the back is flat, scapula not coming up, head is forward, nicely, nice position. And from the side, you have seen before, nice lines. That's nice and what we say normal. But nobody is ever perfect, so you can get some distortions later. So movement with posture follows basically along what we call planes of movement. So when you talk about the sagittal plane, and this is sometimes confusing to some, the sagittal plane is really about moving forward and backward. It means that when you move forward or back, you're working in the sagittal plane. In the frontal plane, or what is called the coronal plane, you're moving sideways. So a cartwheel or any side movement, side lunges, you're working in the frontal plane. And when you move in a corkscrew way, you're talking about the transverse plane. All movements are made up of these planes of motion or movement and in combination. So you can get a combination of sagittal with the frontal or transverse. If you're doing gymnastics, for example, you're running, you're tumbling, then all planes of motion involve in combination. You can see how these planes of motion come later on in movement when it comes to posture. So our basic movement pattern is in walking. But have you ever thought about walking and breaking walking down to its component parts? Really? You've been walking from 1 year old, so you don't really think about it. But if you lose some function or gait pattern, for example, you had a stroke or had an injury, lost a big toe, you have to relearn that walking pattern. So let's take a look at walking. First thing first is a low impact movement, which means at no time at all will both feet be off the ground, which is walking versus running. It's also a single support phase and double support phase. So we start with the double support phase. We start off heel strike. So the heel comes down, you go to foot flat, and that weight goes over that foot with the foot flat, where you are standing single. But then when you move off and the other foot is moving, you're on one leg in late flat foot. That is a swing through, which means you have a one leg movement, swinging through, and then you've got heel strike. Notice where the arrow is here at the other side, but here you're still controlling this foot. So get a toe off, foot flat again, heel strike. So look again, heel strike, foot flat, late foot flat. On the other side, you're going to be that swing through, and then this foot goes into a toe off, believe it or not, and then you get that double control again. So you've never broken on walking. When we finish here, and if you can get up and try to walk it now, that's okay. Heel strike, foot flat. See that single support phase, swing through, heel strike again, and then that toe off. Wow. Walking is not as simple as it seems to be when you've got to break it down. So in looking at your posture, looking at your charges, posture as a PE teacher, fitness professional, or an athlete, you want to look at your posture in your walking. So if you walk funny, you're going to run funny. So remember, you have the stance phase, where you're having that leg is going to control the swing phase, the leg swinging through, back to double support. Let's move it right along. So, posture distortions. And the first thing we look at is called a flat foot or flat feet. Very simple. It means that you have excessive pronation or rolling in of the ankle. Now, what can this cause for an athlete? It means that everything that involves that heel strike and that foot flat, if you get a foot flat, you're going to get that pronation or ankle rolling in, and you're going to have that compression needed to drive. So in walking, in running, in jumping, in landing. So it compromises everything at the first level of the kinetic chain. That is the foot. Take a look. Here's the flat foot. Note that the ankle is rolling all the way in and touching ground. What happens here that then all those muscles on the inside of the ankle all the way to the knee, which will be your soleus muscle, your posterior tibialis muscle are going to be stretched. Going to be stretched. On the outside now, you can have your anterior tibialis muscle, your peroneal muscles being tight. So here's the first imbalance. You have the muscles on the inside of the ankle being overstretched, on the other side being over tight. So therefore, the correction for this will be to get those muscles on the inside, get the plantar fascia to pull back up. But this section, this presentation is not for that. Hopefully next session we will do a screening, functional movement screening and correction. But here is to bring attention to these things, start looking for them and have an idea of what they can cause. This will cause further problems up the kinetic chain. Apart from possibly having shin splints here, plantar fasciitis. What will happen here, in fact, plantar fasciitis really is having that pain under the heel, where the tissue from the big toe here, all the way to the ankle, can get torn and worn, and you feel pain at the bottom of the heel or it's called a calcaneal, right around here. So most of the discomfort comes here because it's overstretched and tearing that tissue. So high jumpers, any person who's using explosive jumping, long jumpers, basketball, who need that take off, we have challenges here in this move, if this compensation we have called a flat foot. Distortion and compensation all the way up to the neck. So let's take it further. We have also high arches. So from being overly flat, you can now have high arches. Again, high arches can cause pain in your instep because you're having pressure on the toes and the heel and the middle. Remember when you went back to walking, you have a foot flat and the foot flattens out. In the high arches, the foot doesn't flatten out, so you're getting pressure at the toes and the heel, and that causes also further problems. So you can see here again, challenge the high arches. You have your toes and the heel touching, and this arch is so high that it doesn't flatten out and causes problems here in the mid-foot. Again, pain and discomfort, distortion, that will go all the way to the neck. So, bow legs, knock knees. Now, you can check at the knock knees, you will notice that the knock knees is also having flat feet. So flat feet can also be a precursor to showing this genus, what we call genus valgum or genus valgus for knock knees. So here is the issue for plantar fasciitis, here's an issue for shin splint, issue for having this excessive pronation here. But the knees come to pressure now too, because here is going to be stretched. So the knees come into pressure on the knees, and also if you look here, you can see now, because that bending, the inside of the leg, what we're talking about is the adductors, ADD, adductor muscles come under pressure, over tight, and that causes further problem of the chain. Here with the bow legs, like yours truly, so I know quite a bit about it, and bow legged as well, pressure will come on the outside because you have this banana-shaped foot here. So rather than have your inside of the leg, of the foot having pressure, your shoes will be worn on the outside, and therefore you can see the outside having pressure, and of course on the outside of the knee, a lot of pressure, and this goes all the way to the IT band up to the hips. So knock knees, bow legs with impact on posture for an athlete, and as a coach, you need to be aware of this because you can do some correction work with this. The bow leg in this, not much you can do with that, but what you want to be mindful of is you work the calf muscle on the inside to compensate for the overstretch of the lateral aspect of the calf here. In this case, you want to make sure that your athletes are arranged with arches to pull the arch up and take some of that knock knee position out of the athlete to get a better straight line in walking and of course running. Let's take it one step further. So we move from the ankle, we move to the knee, let's go to the hip. At the hip, you're going to have, now you can possibly have what is called a lordosis. A lordosis is that excessive curve in the lower spine. On females, you might find it very desirable to say, yes, you look a black ant, but what is the repercussion of this shape? That is considerable amount of pressure here at the lower back, and the muscles here of the erector spinae are going to become over tight. Note that the belt, if you have on a belt, comes below the belly button, and the shape is called the anterior pelvic tilt. Now, we have a lot of this in our athletes, in our general life, because that's the normal, as you say, black person shape because of the glutes. But what it does to the athlete is that it causes pressure here, the lower back, right, the spine, and to the front, you're going to have weakness of what is called the intrinsic core muscles. The intrinsic core muscles would include the oblique muscles, which pull the body forward and do some rotation. It would also involve the pelvic floor muscles, which help in movement of the lower abdominal area. And also you have problems with what we call the transverse abdominals, which is actually the form of a belt around your waist. And that helps with what we call the draw-in maneuver to keep the abs tight, especially with compression. If you can lift weights, if you can do a movement and for a lot of stress, you pull that navel in, a drawing maneuver, and it forms now a tightness and compression to support the lower back so you won't get your back hurt. It also involves muscle of the diaphragm in that intrinsic core. They become weak. So having this shape means you have to now focus on the intrinsic muscle to strengthen this muscle. What also happens here, you have tightness of the hip flexors. And the hip flexor will be the psoas muscle, which you wouldn't really see here, but if that muscle has to keep your back really straight. It's part of you wouldn't see it really connects from the hip to the 12th rib, but the psoas muscle and what we call the front of the thigh, which would be, it can cause problems for not only the back, but also the knee. So hip flexors would be your psoas muscle, primarily. Front of the thigh, make it very simple for you. Rectus femoris, which should be that muscle to the front of the thigh, and it comes down right down to the knee, and right where you can have a tendon can impact there. So this simple, or really say this anterior pelvic shape, can cause a lot of problems: hip flexor problems, knee problems, lower back problems. But also, because of the tightness of the hip flexor, the glutes become weakened. The glute muscles are there for hip extension. So when the hip extension is not doing as it should be doing, the hamstring becomes what is called synergistic dominance. It means it picks up the slack. So a hamstring pull can occur along with the groin strain. So you can imagine that you're having this shape is going to be a precursor, or could be a precursor, to weak glutes, tight hip flexors, and also having problems with your hamstring. Okay, moving along. You're not done yet. So, scoliosis. As a coach and working in the schools, I have seen, in some cases, almost 70% of persons who, of athletes I work with, high percentage, having some form of scoliosis. The unfortunate thing that they do not know they have a scoliosis. And I spoke to one parent, and the parent said to me, "Oh, he just shit just like his father. His father has scoliosis as well." So you could have scoliosis, where it could be, in some cases, inherited, but you can also have what is called a functional scoliosis. So let's move along. Here it is. So you note that one side is different to the next. You have a low shoulder, high shoulder on the right side of the screen. So you have now the medial border is pulling away from the body. It tells you that those muscles now that are supposed to hold it pulling down are weakened. If you look to the front, you notice that the clavicle on that same side is also more forward than the one on the other side. So count on the right side. Take the left side picture, and you see the clavicle on the right side here, which should be to that person's left, is forward. So the left side here on another picture shows that what's happening here. The medial border or the inside border of the scapula is winging. That indicates that there's a weakness to subscapularis, which is the muscle of the rotator cuff, and also issue that would occur at serratus anterior. Those are muscles. If you hold your hand up under your arm, those figs like where you have your ribs, those fig-like structures is really your anterior, your serratus muscle, and those muscles would be probably weakened and causing it to wing as well. Now, how can you get a functional scoliosis? You carry all the way on one side. If you're a postman type fellow and you carry your bag on one side, you carry the groceries on one side, then the body can shift to that side. If your job requires you to do an asymmetrical movement where you're on one side, your body can shift to that side because the muscle on that side, again, you have your QL muscle to your side. The QL is called the quadratus lumborum. You have to pull to the side. If that get tight, it means you're pulling to one side only. So we've got to be careful with our one-sided movements, which are asymmetrical, and not balancing out again on the other side. So balance becomes very important. The body, in its innate wisdom from God Almighty, tries to keep balance. So if your lower body shifts left, upper body shifts right, trying to balance out. So that's why you have this other, what we call compensatory movements, trying to fix the body, or the body trying to fix itself on its own, and therefore you get these compensations occurring. Let's move along. Now, this is a severe scoliosis. Now, clearly you can see that this will involve affecting breathing patterns, it will affect organ shifts. So it can get that serious. I have not seen anyone that serious, but I've seen some pretty bad scoliosis. And I have some competing bodybuilders who actually compete. And what I had to do with them is adjust their training and teach them how to fix their posture, because bodybuilding is a game of illusion. So you can make you see what you want to see based on posture. So if they happen to stand up correct, shift their body weight, and you wouldn't even know they have a scoliosis because of the adjustments made. But in this severe case, there's not a lot we can do unless you have surgery or have a rod put down like that, spine to straighten it out, and everything comes with a cost. A cost in terms of what you have to give up and the risk involved in doing such surgery. Now, what we call this a humpback kyphosis. There is a normal kyphotic curve, but when it becomes excessive, it causes some severe problems. So, how do we get a kyphosis? Well, I've seen it more in girls than boys, but I've seen it in boys as well. What happens in many cases because of breast development, sometimes girls tend to walk with the hands up off their chest and they put their books across, or it's a natural thing to, especially the breast development is more than their peers, they tend to pull it in and tend to hide themselves a lot. So that can happen as well. What can happen as well is that some sports can also encourage a kyphosis. So sports like chess, where you sit for a long period of time and leaning forward, can afford a kyphosis. You can also have a sport like cycling, where you're bending forward to hold the handle, can also cause you to have a kyphosis over a period of time. Bodybuilders who like to do chest, we call men from the chest club, only chest. That chest muscle will pull the anterior front line forward. It will also pull the shoulders forward and give a curve. If you sit at a computer for a long period of time, you're driving, you can find yourself with a little bit of kyphosis and develop what is called a forward head posture. So the neck goes forward. When your neck goes forward, then you're stretching the muscles to the back, what we call the deep flexor muscles, cervical muscles of the neck, and therefore the capital muscles at the back of the head become overstretched, and you have a forward head posture. And we don't want that to happen because that causes further problems. For shoulders, you can get shoulder problems, shoulder impingement, and a lot of shoulder impairments because of this forward head, and because of the kyphosis, the thoracic area comes under pressure as well. Your upper area of the chest comes under pressure as well. So let's take it one step further. So having looked at that, you now look at what is called a kinetic chain of movement. So you recognize that if you have a distortion in the lower area from the legs, especially if you have to do a lot of force to the ground, if you don't have that correct foot plant, if you have a distortion where you have that high arch or low arch, you're not going to get the compression because you're going to have, especially when we have the flat foot, the knees coming in. So for gravity and for the center of gravity, that straight line you have of force, the knee is going to collapse. You're going to lose some of that force, knee collapse. The knee collapse, the leg's not getting that force that you should get to drive in. The trunk will have a rotation because it means that if the knee collapse, you have a low hip. So that low hip will also bring it into a little bit of trunk rotation and back. That moves you out of full alignment. Your shoulder will also get low. The elbow will come under pressure and extension, and therefore the wrist. So imagine you doing shot put and having a flat foot. That flat foot could impact you as a shot putter, even throwing javelin. because everything has a knock-on effect, and based on force, you will lose some of the force, and therefore you're not going to use your best effort if simple as a flat foot occur in your kinetic chain. So here's a tennis player doing a forearm rally. That forearm can be affected and is affected because of the knock-on effect because of the leg. Therefore, you will not get the full impact. So you play tennis, netball, volleyball, because of a simple, and I say simple from the point that it's a first line of kinetic chain, can cause you all the way up. So pay attention. So you, as a PT teacher, fitness professional, as a coach, as an athlete, look at your charges, look and see what's happening with the feet. Are they having a flat foot? Are the knees knocking in? What's happening with the trunk? Are the shoulders low? Do they have a scoliosis? You can look at these things and then try to have what I like to say is a multidisciplinary approach, because you don't have all the skills. So you want to contact your podiatrist, you want to check with your sports scientist, you want to check with your physiotherapist, you want to check with your sports therapist. You want to make sure you get the best people to look at your athlete, you identify some issues, and let them help you to correct them as you go along. So this is the beginning of the kinetic chain, the javelin throw. And look what we have here. Heel strike. Heel strike. Now you need a power at a heel strike to drive your body forward, because the speed of the heel strike and that foot plant will inform that javelin throw from the kinetic chain. So once again, if that kinetic chain starting is not right, you're not going to have the best throw at all. And therefore, all I'm saying to you is pay attention and see where you can do some correction, there you can identify, start with the first kinetic chain, looking at that foot and ankle from that flat foot. You want to get that normal or neutral position going on there. So let's move on and see what happens. Here's at the end. So at the end of the kinetic chain, if you haven't gotten it right, you're not going to get a best throw. So even though you may not recognize how important it is, you can see the end of it. Remember, from kinetic chain of movement, starting from the ankle and the foot, get the posture going right. And then we can then deal with the imbalances from there. Once again, what I'm showing you here is the importance of kinetic chain all the way through. So here you drive off, but you're not made. There's nothing you can do when you get in there. There's nothing you can do when you get into the air but land, the parabola. So the speed of movement, look at the height of the movement, but what it starts from that leg, that drive. If it's not correct, it's not getting that foot flat, that toe off, that driving form, then at the end will not be your best form. So I have a question for you. So what's wrong in this picture? We know how to about 20 or 30 minutes of dealing with posture. What's wrong with this posture in this picture? Give me some feedback, anyone. Tell me, what are you seeing there that we talked about this morning so far? We talked about the foot flat, we talked about looking at the foot and the ankle, we talked about the knee, and we talked about not knee, we talked about bow leg, we talked about hip, we talked about shoulder. What's going on there that you think that you need to work on in this youngster running up to do a long jump? Talk to me.
So like they got not knee as they're running, and so as they run, their foot is not going to plant directly in front of them. It's going to plant to the side.
Ah. So what plane of movement should they be in? We said they should be in a sagittal plane, which is forward. What movement, what other plane of motion are you seeing going on here? I remind you, the transverse. So they're going across.
The transverse.
Yeah. So they're not really fully in a sagittal plane. So some of the effort then that should be really be seen or be given or be performance-wise should be that going forward with the sagittal plane is now going in a bit of one you see that transverse and also subfrontal plane, because they can go sideways. So look and see how that movement shifts them from going in a straight line, which means technically they may run a longer distance, because in a straight line, as you know, 2 points, that straight line is the shortest distance. But if you're running zigzag, or anything deviating other to, and that straight line, they run in a longer distance and of course a distortion. What type of problem you think likely to happen here because of this, based on what we said? Anyone?
Ronnie started saying weak abductors. Is that a possibility?
Not necessarily weak abductors. Abductors may be over tight now. In this case, because they're pulling inward. So the adductors are over tight because they're pulling in because of the shape. So they're pulling in, but then you're going to have no challenge with the glutes and the IT band, because IT band is going to pull it back out. IT band is coming from the knee on the outside of the knee up to the hip. The IT band is here. So you got to pull it out. You got to now fight against this now. So the glutes now. So your glute activation work got to be done. Glute activation work got to be done to also pull it out, because the glute activation work is going to pull it out into abduction. Abduction is away from the body, and then also because of the hip extension. So here we have hip flexion. So hip flexors are going to be tight and pulling in because tight adductors are happening here. Yes. Anything else we've seen here? Good so far. Good observation. Talk to me. What about that foot plant? What will happen because the knee's going in? What's likely to happen here with this foot? You're likely to have possibly a pronation, excessive pronation, because the knee's going all the way in. Once the knee goes in and it collapses in, it means they're going to be rolling in of the ankle. So rolling in of the ankle is going to be also a factor going here. So we have the rolling in of the ankle, knee going in, and therefore it affects the movement of this youngster going up to do a thumb jump. Good observation. Very, very good. At this point in time, we're going to open the floor to any questions pertaining to posture, imbalances, and movement at this time before we close it down.
Good morning. Who are the persons that we can take a child to if we have observed certain deficiencies in their movement? Who are the professionals that we will take them to?
Well, you want to look at your physio. First, if the child has what we call comorbidities, the child has other issues, you want to have a medical check. And that's that parent have that child checked by a professional. And there are certain doctors who will be more acute to this. So you have Renee Best, you have also Dr. Lord. We also have well, these are doctors first. Then we go doctors first. Then we go to the physiotherapist, and we have quite a few. You for sports physiotherapists. You can also look for a sports therapist who is also trained in massage therapy or rehab therapy, and you can also look for in some cases sports massage therapy. But it has to be someone who's involved in sports who can identify what you're dealing with. And so, in terms of a list, I'm not going to give you a list of any particular person. That is of your choice. But what I would say to you is, you can speak to a physiotherapist who has a sports therapy background or a sports physiotherapist. You can also speak to a sports therapist who's trained in this area, massage therapist, rehab therapist, sports scientist like yours truly, who will able to direct you. But I'm not soliciting, so the choice is also always yours. But the person will have to know what you're looking for. What you need to look for, the person must understand how to correct muscle balances, how to identify muscle balances, muscle weaknesses, and be able to correct them in a sports specific domain. Okay?
Let's believe that was Christy Keir's question. Yeah, that was Christy Keir's question. Okay, coming on the chat. Mr. Morose and George Perry. I have noticed that some flat-footed children in the classes, beyond notifying and encouraging parents to take the steps to seek proper help, is there anything you can suggest that I can utilize to assist?
One of the first things you want to do is start looking at strengthening the outside, or we call it lateral gastrocnemius. That's the outside, because what's happening with the flat-footedness, remember the inside ankle is going to overstretch. And therefore, the challenge is going to be strengthening on the outside of that muscle. So let's make this simple. You have the ankle rolling in, and if you're familiar with foam rolling, you want to first and foremost foam roll from the knee to the ankle on the outside. Let's foam roll it first. You want to foam roll it, and you want to foam roll it to create muscle inhibition. And muscle inhibition means taking the tension off first to create that balance. So you don't want to have that overly tight and the other side, let me say, overly stretched. So let's take that tension off first. So you want to foam roll. So you're going to have that child or that person lay on the side and do a foam roll. The foam roll is not meant to stimulate the muscles, so you go very slowly. When that athlete feels that soreness or any soreness in the area, you want to stop the foam rolling right there and hold it there for at least 30 seconds to allow autogenic inhibition to occur. In other words, the brain will tell that area to release that tension. Every time you feel or that child feels any soreness, you want to do that same thing till all the knots are out. So the first thing you want to do is foam rolling, what we call a myofascial release. Myofascial means the covering of the muscle, gripping the muscle up because of the position in. You want to release that tension first and get that happening. Next thing you want to do is you want to do some strengthening of the anterior and posterior tibialis. We start first with the posterior tibialis by having that person pull the ankle forward, and turn that big toe inward. By pulling the ankle forward and turning the big toe inward, what you're doing now is contracting the posterior tibialis and to some extent soleus muscle, and tightening up the inside of the ankle while stretching the outside and creating balance. So remember, after you've done your inhibition, the muscle will be a little more relaxed. You want to pull the ankle forward on the heel, pull the big toe inward, and that will contract the inside of the ankle, tightening up the medial gastroc while the lateral or the outer gastroc is being stretched, and that will create a little bit of balance. So I'm giving you something you can work very well. You want to inhibit that outside. You want to lengthen it by stretching it, and by stretching it, you're pulling the inside to tighten. So it's a combination movement where you're pulling the inside by pulling the ankle forward, turning the big toe inward, and contracting the medial aspect of that calf, that gastrocnemius. Another time you've got strength on both inside and outside, but initially you want to take that tension off on the outside, tighten up on the inside by pulling that big toe inward. The medial border of that flat-footedness will tend to come up a little bit more, but that's your initial. You want to have that child also wear shoes with arches. Other than that, you got to go to podiatrist and get an arch support and things of that nature. So that's your first line. Inhibit the tight area, strengthen and tighten up the inside to create balance, and we work from there. Next question.
How old do you think a child should be to get this type of rehabilitation? Because the child in the picture that we have here may be about 8 or 9. Do you think that this is something we can do for a younger child?
In the National Sports Council bodybuilding program, we start at 6. And if you can identify, now there is again, as I was to get a professional, you can get a flat-footedness that only occurs in the child when it's loaded, but you don't necessarily see it seems to have an arch. Only when it's loaded, you get flat-footedness. But I would say to you, if you see a child with pronation at any age, if you have that genus valgus lead knocking in as well, you can start to strengthen the muscles up on the inside. Yes, because that is going to roll inward, that foot is going to roll inward, and you want to create what we call a neutral foot position, which means the foot is now not rolling in, not rolling out, kind of neutral. So you want to start with good walking habits. So you can retrain from simple, again, foam rolling. And foam rolling, I would suggest if you haven't been doing foam rolling, you can do it with want to get a foam roller with a diameter of 6 or 8 inches. You don't want to have a big foam roller when you're first starting off for young children. You don't want heavy cleats. You can even get a piece of PVC that has no cleats and start the foam rolling, because all you're really doing is informing the brain to relax this muscle with inhibiting the muscle. So the smaller the foam roll is, the tighter the pressure will be on that individual. So you want to get a big foam roller, 6 or 8 inch diameter, and start from there. You can start from early. But what you're doing here, you're really retraining the neuromuscular system with the brain and the muscle can work in sync. That's what you're really doing. And you can start that from very early. Remember, if you're in swimming, you start as soon as you're born, swimmers start, and they start doing this myofascial work from early, because you can retrain the body into good position early, then you can get good function for efficiency of movement very early. Yeah, next question.
Christy here. You can have Christy here.
Yes, good morning. My question is, in the case of mild sclerosis, right? You were saying that there's weakness on one side, so then the exercise should focus on strengthening that side, then the weak side.
Correct. But before you start to strengthen, that other side is going to have also muscle tightness. So in other words, you cannot really get to strengthen the other side if it's over tight, because it muscle balance. So the first thing you want to do, that side which has the tightness, go again, muscle inhibition. You got to go and do a little bit of foam rolling, then you do the foam rolling, then you do the stretching. And when you do the stretching, then you do the strengthening on the other side. So yes, that's the process. 1, inhibit the muscle, which is cause the muscle to relax. 2, right after inhibiting, lengthen the muscle, which means you stretch it out. And then right after that, you then apply then a muscle strengthening technique to the opposite side right after, and that gives you 3 of the 4 combinations that should be done. The other one is really what we call an integrated movement, but that will come in our next session. But for now, you can start by 1, inhibiting, which is you can do the foam rolling, nice and easy, no pressure. Once you've inhibited that foam rolling, you don't want more than about 5 or so minutes of foam rolling, really. Once you've done that, you then want to do a stretching of the area. And once you stretch the area and become more pliable, you apply then a muscle strengthening on the other side, or the way we call the antagonistic muscle, the other muscle that will be working against that to get that posture then into more balance. Very good question, and yes, that's the way you would do it. Inhibit and stretch that tight muscle, then you go to strengthening on the other side. Yes. Next question.
Next question comes up in chat. Would you say that one of the issues we are experiencing right now is the use of inappropriate footwear, leading to a lot of challenges? Is there something we can do on a national level to educate on the importance of appropriate footwear, especially when it comes to PE and sports?
Very good question. And what we're doing now is starting the process, because we expect you, as a knock-on effect, to take this to your charges. And yes, footwear is critical, because we said at the beginning of the kinetic chain is that if you don't have that correct neutral balance, then if that child is wearing a footwear that does not create a proper support, and every step they take, they're going into excessive pronation. Look at the picture on the screen and see what happens. And that's there for a reason. Every time that they go into excessive pronation and foot roll in, the knee is going to come in. Therefore, your gait pattern will change. Your running pattern will change. And yes, if you want efficiency, you have to get the right footwear. So your job here as PT teachers, as health fitness professionals, as coaches, as athletes who are listening in, is to inform parents that footwear is important. Footwear is important in not only just for running fast, but for protecting that child all the way up to the neck. As you saw in the kinetic chain of movement, it would impact the knee, the hip, the spine, the shoulders, right up to the neck. So yes, footwear is critical at the beginning. That's why this particular series is the foundation for others that we're going to build on before we get into dealing with really building a training program, because the training program must involve some corrective mechanism at the beginning in your warm-up if you're to get it right. Yeah, next question.
This one speaks more so to secondary school students, in particular first formers. In first form, you see first formers with these bags, loaded bags, and as you would have stated, they compensate by leaning forward to compensate for the weight of the school bag over prolonged periods. Can this have implications? And if so, what can be done to assist them?
Education, education, education. Leaning forward consistently with that weight is going to cause the hip flexors to tighten up. Because they sit down for considerable length of time, they sit down for computer, they sit down to read, sit down for lunch, and therefore the hip flexors. So you go back again, right at the front, and you can put your hand in, right now into that crease of your waist, and right in there is where we get now. You have your hip flexors starting from there. You have your psoas muscles, and upper abdominal area to the side. You have going down the rectus femoris on the front of the leg. They will tighten up. When they tighten up, they're going to cause weakness to the lower back as well, because leaning forward, center of gravity is going to be shifting. So again, it's going to go to what we call compensations and distortions. So yes, that will cause tremendous problems over a period of time. Tightness of the hip flexors, weakness of the intrinsic muscles, glutes will become weakened, hamstrings will become under pressure, and it changes the nature of how that child will walk. They may find themselves with a kyphosis as well, because if you pull the shoulders forward to control the bag, then you get rounded shoulders, chest becomes tight, they can have back problems, they can have shoulder problems, and other problems as well from that. So yes, education as well. Please educate your charges about having erect posture, because you don't want the long-term effect, especially athletes, to have those areas, because then it will hamper them for a long period of time. Yes.
Hi, me again. So in a case where, because we have COVID-19 and we are at home, and we encouraging parents to keep the children active, what is a good substitute for foam roller for a parent to be able to use at home?
You can get a piece of PVC, simple PVC. If you've got a rolling pin, it will be smaller, so you got to take your time with it, but a rolling pin can work. Anything symmetrical, you want to make it symmetrical so that the top and the bottom are the same size. You don't want to use a bottle whereby one is high and one is low, because you want even pressure on the tissue. But anything symmetrical that can hold the force, a rolling pin, PVC. But I would suggest, again, if you're now starting out with foam rolling, you want to use a larger one. But if you have a small one, just go slower and take the time when doing it. But that can be done as a substitute part if you don't have a foam roller as a foam roller person.
Coming from Mr. Morose and George Primary. Further to the above question, one of the challenges we experience, especially in the primary school, is the restricted coloring of footwear, predominantly white. And unfortunately, white footwear is more style than function. Education for sure is important, but this extreme restriction does pose further problems. So you're having a lot of courage.
One of the things you also won't want to have a shoe that is overly stiff. A shoe must still have pliability to allow movement to occur. If the shoe is overly stiff or it collapses, either way is extreme will be problems. You can also get shoe inserts, again, and you can consult CAV Rehab, where you have an occupational therapist who also looks at footwear, but you also have Summit Rehab, where you can also, CAV Rehab is in Turning, and also Summit Rehab is in the same area. Not soliciting, but I can tell you where you can get them from. You can also look at nights in some cases you may have, but I prefer you to go to one of those places where you have a professional. You have Fitness Burnett also in Warren, who also has self-supplies. But you want to make sure you can get a good for that child's age and stage of development. Get an insert, a female versus male, so it's a little different. So you can get either a form one or a more sturdy one. If it's more severe, then you can contact your podiatrist when you have one fabricated for that child. But as the child grows, it will, to get a different one. So then there are mechanisms. But I would say that, if it's too stiff, it causes problems in the shoe. If it's too soft, it causes problems. You can get an insert, so you can contact care rehab, not soliciting, but no reading sole. You can go out to Phyllis Burnett, you can check up Warren, you can also go to Andrew as well at Summit Rehab, also physiotherapist, and you can get a fitting if possible for that pronation that can cause problems of the ankle rolling inward. Yeah.
You spoke earlier about ways to identify problems, like simply watching how they walk. How is this done in terms of breaking it down? Should I have a line? Should I have them walk to zigzag? And are there any other exercises that I can use to help me spot any inefficiencies?
Okay, the first thing we're doing, that's why I stated today we can really look at static posture as opposed to transitional and dynamic, because they will require you to have some other observational skills. But for the purpose of the exercise, you want to look at them first in static. If you do not know what is normal, it's difficult to understand abnormal. So you must first know what you're looking for. That's why I introduce you to heel strike, foot flat, single leg, swing through, and then heel strike again at double support. So you must understand first the walking pattern to understand an abnormal walking pattern. So this is the first thing. So in this case, you want to look at static first, and then in their walking, it's a little more technical, but you want to see if they're walking, if the foot is going to collapse on the inside, the knees collapse on the inside, even before running. So you can have them walk individually. Again, functional movement screening will take care of stepping over a barrier, but just walking. Walk normal pace, walk full pace, and then ask them to walk then in a stretch way, let me say 30 inches. For a child, that's a long way. So you're walking, and you want to emphasize heel strike and foot flat. So have them walk normal first, tell them what we're looking for, and they have them walk in the direct way they're supposed to walk. Heel strike, foot flat. And if that goes foot flat and that foot rolls inward, even before you have to take the shoe off, because if you have a flat foot, you can see deviation. So you look for those things. You look at the knock knees, bow legs, things like that. So those are the things to look for. You look for what we call movement patterns. But you must first know what is normal before we do abnormal. So what is planned in your next series of movement education is to look at the transitional and dynamic part of the assessment, which involve looking at the squat movement and of course walking patterns, which you know then what to look for observationally and how you can also do some correcting to some extent. So, but I would say to first go back to what I said before. You're looking at what is normal: foot flat, heel strike, foot flat, toe off, and again another foot flat again. Another heel strike, then foot flat. We're looking for is to make sure they're following the right pattern of motion. You're looking to see if the knees are caved in when they're walking. So you're going to watch them at the front. You're going to watch them at the side. Watch them at the front. We're going to see if their feet are, if they're walking, we call shannon foot, where their toes are going out. You look at the front and see if they're walking pigeon toe. It tells you that the hip is rolling in. And then from the side, we'll see if they're leaning forward or leaning back, and if they're lined up. So that's my advice to you. Watch them from the front. Check to see if they're walking what we call shannon foot, where their feet are going to be, the toes are going to be out to the side, or they're walking pigeon toe, where their feet are pointing inward, which indicates there's a rotation of the hip either way, and that gives you a pattern of abnormality. And then, or they're walking straight, which is good for you, and then check the side to see what's happening to the side. Are they leaning forward? Are they leaning back? Are you getting a straight line movement? So, at a basic level, that's what you can do, and then you make your notes on what you see.
Okay, one more question from the chat. We're almost out of time, so we're going to just do one or two more. What corrections should be made to a child who has a tight arch?
High arches are challenging because all we can do with them again is get an orthotic, really. Because in most cases, the high arch really is going to be a structure. It's going to be a structure. And the challenge with that is that the weight is going to be on the toes, on the heel, and you're going to have that hollow inside there. And what you want to do is have an orthotic then that can fit there so that you can have a bridge more or less for that. So with high arches, I would suggest you go to your podiatrist. We have a few podiatrists in Barbados. Simon, and we have as well. So you can make the choice of who you want to go and see. But with high arch, which is the one challenging because it can cause painful problems for the child in that midfoot, and you want to leave it at early o'clock. So yeah. Okay, well, thanks once again for those on the call and the chat today, and we're happy to have you in the Zoom. Hopefully next time on this because I'm going to do a series, we look at the movement aspect of it, transitional. We're looking to see how 7 particular movements, what is called a functional movement screening, can be used. Primarily the squat movement, where you can see everything you want to see really in the squat. And then we see what happens then from movement in a dynamic assessment, and from there, correctiveness and how you can build your program from there based on how you do this correction bit of it and then move into your program as normal. Thanks once again. Valance Humphery, National Sports Council, bodybuilding coach, sports scientist. Until next time, have a good one.
Good evening.
Welcome to part 2 in relation to looking at posture assessment. Today we're looking at the squat as an assessment tool, and I will also offer you some corrective measures.
First and foremost, we're looking at what is called functional movement screening. Now, functional movement screening, or what is called FMS, is really a system that allows a professional, whether you're your coach or your therapist, to assess the individual for the movement pattern. And what you're really looking for is compensatory patterns. And to do this, you can use a screening mechanism. You can do this before person goes into serious training, so it can be done before an assessment, before performance. It can be done also as a monitoring mechanism or for rehab purposes. So, you ask, what is a squat? Well, using a deep squat really is considered to be a total body biomechanic assessment. Using the FMS approach or the functional movement screen, you can use a dowel, which is placed overhead, and that has a mechanism looking at the bilateral or symmetrical mobility of the shoulders, thoracic spine, and it goes all the way down, right down to the ankle and foot. So the squat is a total body assessment. By using the squat, we're going back to the kinetic chain of movement and doing what is called a joint approach. This is done because if the joint is supposed to be mobile, is actually restricted, then above and below is going to become problematic. So you have some compensations, and therefore we start to look and see which joint should be mobile, which joint is to be stable, and I will assist you with that at this time. So when you're going to look at your assessment, before we get deep into the squat itself, you can look and see the ankle should be mobile to all planes of motion. The knee is to be stable. The hips are supposed to be mobile. But if the hip is stiff, then the lumbar spine and the knees become problematic. And rather than become stable, then you're going to have problems then being hypermobile. Thoracic spine is to be mobile, it gets to be breathing. And for shoulder girdle, stability, because it has to have the shoulder joint, it connects also the thoracic area, so it has to be stable. The glenohumeral joint, or what we call the true shoulder joint, mobile, the most mobile, but because it's so mobile, it lacks some stability. The elbow should be stable, and of course the wrist should be very mobile. So using a joint by joint approach, you can see if for any reason that the stiff joint becomes hypermobile or vice versa, a mobile joint becomes overly stiff, you got some problems. So before you can look at compensations, you need to look and really understand what is the normal squat, or how do you perform a normal squat. Looking at your screen, you'll see that you have the start position, hands above head, feet shoulder width, both toes are pointed forward. Now, as you lower the body, remember you want to have your hips going backward. The knees now should be in line with the toes, and the pelvis should be level. And you'll see that on the right side of the screen. So here you start. Technically, here you finish from the front of a normal squat. From the side view, your back should have a slight lordotic curve in the lower back. But what you should have is kind of a parallel between the shin and the spine. On the right side, you check to see the head. The eyes are forward, but the ears, if you see, the ears are also kind of like perpendicular. So the head is straight, level, eyes forward, not looking down, not looking up, and that's where the head should be, and that's where the lower back should be. Because if you don't understand normal, you really can't understand abnormal. Now, if you take the functional movement screen squat assessment, this mechanism using the dial, this is what you should see for a deep squat. From the front, you should see the knees level, toes forward, using down the hands above the head, and from the side view, your hands should be in line with your ears. Now, what I'm saying here is that I would prefer to have the assessment done barefooted, because shoes can give you a false sense of the arches. So I would prefer you to have, when you're doing this, make sure you have your charges barefooted. So you can see the arches are falling, and then you can then address other issues. So one of the things you do when you have challenges with the heel coming off the ground, which is the most common issue, is you use, let me say, a 2-inch board, and the FMS has this system that you can use to adjust that. So even though you're adjusting here in this photo you're seeing, the heel adjusted, note the knees are coming in. We got genus valgus, the knees coming in. And then that's the front view, and the side view, you can see there's more challenges there because the hands forward, the head is down, and therefore you can see that there's a lot of challenges here with the shoulder, the chest, which you're going to unlock in a little while. But the heels not staying on the ground tells you that the gastrocnemius is over tight, and you can also adjust by putting that there. Using that elevated heel, it places the person in good center of gravity and allows them to do the squat. The squat, when you pick it apart this evening, you will see that you will find you can use the squat alone as a basic assessment. This is using the same elevation, but without that other compensation, the knees going in. So this is a better approach to doing the squat with the heel elevated to prevent that compensation of the heel coming up. Now we get into some business. This is what you should see in an overhead squat, and this is coming from the National Academy of Sports Medicine. So, look at the alignment. This is what they're looking for. For the front view, knees over the toes, very nicely. Side view, you see the parallel lines, hands and the shins parallel. And for the posterior side, note the heels straight down and the pelvis is level. When you see deviations from this, is when you know the person is compensating, and that's what this discussion is about this evening. How do you deal with compensations? First, we deal with normal, then we deal with the compensations. So let's do the compensations. So flatten, feet flatten. The first thing you're gonna notice here is that the knees are also in. So when you have the feet flattened, it means that the inner part of the calf, what we call the medial aspect, the inner part of the calf is being overstretched. So that's your soleus muscle and your posterior tibialis. So you can put your hand on the inside right about now, get a full feel, and get an understanding of everything medial and lateral. So the inside is medial, the outside we call lateral. So to fix this, or to deal with the compensation, we have to now, one, because of the knees coming in, foam roll the knees. You're gonna foam roll those knees, inside of the knees, so you have those adductor muscles that are on the inside tight. You want to make sure those muscles release. So you want to foam roll, and then you want to stretch those muscles. You want to also foam roll the outside of the lateral aspect of the gastroc. So the outside of the calf, the outer part of the calf, you want to also foam roll. You want to also foam roll that area, and you want to stretch it. For the hamstring, the outer part of the hamstring, you got to foam roll because it's also tight. That is your bicep femoris. So those areas have to foam roll. Also the glutes. So that's what we're looking at. So let's go over that again. Feet flatten. You need the inside is being stretched. This outside is being really going to be tight. So you want to make sure you foam roll the outside of the calf. You want to foam roll the inside of the thigh because they're also pressed inward. And once you foam roll those areas, then you're going to stretch them. And you want to make sure you strengthen glute max and also the IT band. And you want to make sure that also do a foam roll on the hamstring, outer portion. Any question? What's the takeaway? When you see it, just remember that we're looking at the muscles, one pair or one set being, maybe say for argument's sake, overactive, and you want to compensate, the one that works against it up. We were saying one underactive, one overactive. So if the inside of the leg is overactive, the outside is underactive. The underactive muscles must be strengthened. Are you with me, Kat? Make sure you understand this before you move on, because it's a principle that follows all the way through. The overactive muscles must be foam rolled and stretched. The underactive muscles must be strengthened. And that is the principle of getting the muscle balance. Let's go to the feet turn out. The feet turn out, you know clearly that the outside then is going to be an issue. Because the outside is going to be pulling out and will be overactive. You're going to be pulling out, will be overactive. So you're going to make sure you foam roll on the outside, which is the IT band and the glutes. In this case, you want to make sure you foam roll close to the hip, which is glute medius and your tensor fascia lata. So put your hand on the hip, feel the hip bone. Just above the hip bone, you have your gluteus medius minimus. Top of the hip, just on the inside is the tensor fascia lata. And you make sure you want to make sure that you want to foam roll and stretch, because they're pulling the knees outward, and therefore the inner part of the legs, which is your abductor muscles, you got to strengthen those and put them back into balance. The feet turning out, it means that the outer part of the calf, the outside is pulling it outward. So you got to foam roll again, and you got to make sure that you can pull in and strengthen the inside of the calf. all you got to remember is that overactive muscles are the ones that are tight. Underactive muscles are the ones that need to be strengthened. So knees moving inward. Once again, locked up. And therefore, once you're locked up, the knees going in, you got to go and work inside of the thigh. Form roll, stretch them out, and strengthen on the outside. And same your knees moving out as we did with feet turning out. You make sure you form roll outside, strengthen the inside. And those are the some basic compensations. And the ones you tend to see a lot more coming up now. So, lower back. You can have a lower back like this, lower back arch, if the muscle lower back are tight and they pull and draw you in. What also happens when they draw you in, the glutes now become, as you say, underactive. So your glutes, we're going to need some work. So you're going to make sure you strengthen your glutes. For lower back arch, you're going to make sure that your hip flexors, which unfortunately here would also be weakened, are tightened up. But the belly muscles, which would be your abdominal area, and want to be tight. So, because they're pulling forward, if you get tight muscles here, as you see in the abdominal area, your glutes are going to be also underactive. So, glute work will be bridges. So, for a lower back arch, where you have the sinking in the back, you're going to have weak glutes, weak hip flexors, tight abdominal area. So bridging would be that important movement to get those lower back arches out of the vein.
Taking questions on these?
Yes.
Okay, so coming out of the chat, we have a question from Mr. Shepherd of Welch's Primary. He said in the second picture, it seems apparent that there is a misalignment of the hips, which in turn seems inductive in poor to no activation of the glute medius, as well as poorly firing hamstrings, or a permanent external rotation of the hips, which will reduce the ability of the model to squat properly. Prior to foam rolling the areas, would you suggest any other methods of addressing these issues that the model has displayed in the image? So looking at the second one.
Lower back rung. Lower back rung really is an issue with glutes first, again, which being weak.
This is the previous one, not this one.
What you have
Previous
here
image.
is tight abdominal area as well. But in case of the hamstring is actually over tight. Now the hamstring over tight is because it's compensating, or what we call synergistic dominance. It's picking up the slack from the glutes. And the reason the glutes will be, in this case, will be a little weakened because the abdominal area becomes over tight, pulling forward. It can cause a hip misalignment, but it will be a case where you have the posterior tilt rather than the anterior. Yes, pulling it, or we say tucking it under, which can cause some serious problems for the lower back as well. So yes, foam rolling. You want to adjust your posture, so you get back to basic posture. But foam rolling, before you do anything, any stretching, foam rolling area, foam rolling will inhibit the muscle. And you want to foam roll by going in very slowly and pressing down, and make sure you have at least 30 seconds on any sore spots, which will allow you to have what is called autogenic inhibition, which is the brain telling the muscle to relax because it puts some pressure on it and reduces the blood flow a little bit. That causes it to release. So that's how we deal with that. So before you do anything, you want to foam roll, and then you want to stretch. Any other questions?
Just checking to make sure that he was he's querying the picture we're looking at. And if you he's talking about the second one on the previous slide.
Okay. Go back. Okay. So feet turn out.
Feet turn out, yes.
Again, you have to make sure that if feet are turned out, it means that the piriformis, again, part of the glutes and hip area are going to be over tight. You're going to pull the body out as in the case of the knees moving outward, similar, but it's turning outward, and therefore you start from foam rolling, foam roll and stretch, and then you strengthen the adductors on the inside. Foam roll, stretch on the outside, adductors on the inside, and will be strengthened. Yes. Okay. So lower back round, and we go again. Just to show you, cover your lower back round. Lower back round is really because one, the rectus spinae or your lower back and glutes, the muscles there are underactive. The muscles of the abdominal area and the external obliques are going to be overactive. The hamstrings in this case are going to be tight because they're picking up the slack from the glutes. So I want to get the feel of what's happening here. Once the glutes are underactive, the hamstring picks up the slack, and in some cases can become strained because this job has now been increased from pulling the knee back to now flex and now extending the hip, which is now shear with the glutes, but now has almost total workload. So that's the reason for that. Okay. Excessive forward lean. You see this a lot. How do you see excessive forward lean? You're looking at the glutes being, again, being weak again, glutes being weak, but also the let's say the hamstring in this case, tight, and also gastroc. So the calf is going to be tight. Calf is going to be tight, glutes are going to be weak because you can see how far they bend forward. So it tells you that your abdominal area is going to be also tight. Hip flexors are going to be under pressure. But look at the hands coming forward. It tells you also that there are challenges with the chest muscle and the back muscles. Hands falling away tells you that the what we call the pectoral muscles are pulling the hand down as well, pulling it away from the ear, but it should be in a good alignment. So there's some challenges there with the chest muscles as well. In case of let's say the lower back, because you bend so far forward, the lower back will become underactive as your abdominal area pulls you all the way down. So this is a case whereby the posterior chain muscles need to be worked on. The glutes and the rectus spinae or lower back muscles need to be worked on. Arms falling forward, head is in good posture, arms falling forward. Again, you're looking at area of shoulder, but latissimus dorsi, the back muscle. So take a look and see where our waist at this time. Believe it or not, the back muscles would also be a factor because if the back muscles are over tight, it has to pull, it doesn't allow the chest muscle to come all the way up and bring that up to the ears. So tight muscles, latissimus dorsi, causing the issue here. That is a serious problem. Any questions so far? Let's move on. So, when you do it from the back, this is a serious compensations that likely to occur because you will see the feet planted from the back as well, if you discuss. You see that ankles deviating and going upward. Very serious. In case of the heels right out off the floor, you also see this from behind, and you can make an adjustment by using a block from 2 inches or so under the heel to adjust the center of gravity. Okay, now this one to the right, the asymmetrical weight shift is the one I really will spend some time with here because this is very challenging. And you tend to see this a lot in girls. Compensate. I've seen this a lot in girls compensating and shifting to one side. Now, You go slowly with this one. Note that one hip, in this case, goes shifting to the left. You also note that there's no symmetry at the hip. So have a high hip technically and a low hip. The shifting to the left or shifting with the arrow goes pointing outward is very serious. That is telling me that your IT band is pulling your hip out to the side. You may not just look familiar with the tensor fasciae lata or TLM, but the tensor fasciae lata, okay, that is at the top of the IT band, just to the front of the thigh. So if you come up the leg from your knee up to the hip and rotate slightly inward, that's where you will find your tensor fasciae lata or TFL. It's important because that becomes tight. That is also a hip flexor, and you need to pay attention to that particular muscle. So your IT band will get very tight here. On that same side that is shifting, the adductor muscle will also be very tight. It means that the adductor muscle being tight, even though you're shifting, it's going to pull the knee and pull the leg inward. So the hip is going to be out of alignment, seriously, on the left side. On the right side, the adductor complex is going to be quite weak. So you're going to be not pulling in on this side, but on the outside, all the musculature is going to pull it out. So you have your glute muscles, piriformis muscle, your gastroc or your calf muscle being very tight as well, hamstring being very tight, pulling it out. And that's why one side is giving you that pull to the left side, and then there's a compensation of the shifting. The compensation occurs also because the hip is going to be pulled upward on that side, and the knee is going to be knocked in on the right side, and it drops down, giving you that hip drop. So lots going on here. The most important thing to recognize in the shift is where you see that shift. Wherever you see that shift, you know that the IT band is pulling on that side, pulling to one side. On the right side, the calf muscle is going to be also tight. What we're hoping to have is, that's what's going to sometime in the future, is a workshop on this, where we can have a live demo and we can actually do the foam rolling and the stretching as we go through the program. Any questions at this time? No questions? Well, let's do a little bit of a recap before we close it down. Remember that when you're looking at transitional posture, especially the squat, you start from the ankle. The ankles are rolled inward, knees in. Those areas clearly are being, for the ankle, being stretched inward. For the adductors and the top, it's being pulled inward, being tight. So yes, catch at the bottom, tight at the top. Your object is to make sure that all the muscles that are overactive are foam rolled, and they also stretch. All the muscles that are underactive, you're going to make sure that underactive muscles are strengthened. We're having excessive foreign lean. You're having your lower back being underactive, the glutes underactive, and your abdominal areas are going to be overactive, being very tight. When you have your back sink in, what we call lower back arch, those erector spine muscles can become very tight, but the glute muscles, once again, are going to be underactive. Once it's underactive, hip flexors are going to take over and be tight at the front. So if it's underactive at the back, it's going to be quite tight at the front. In your lower back round, in this case, you have both the lower back and the glutes being also underactive. Therefore, the abdominal area to the front being over tight. And that's where we focus on. Hands fall away tells you that the chest muscles are being tight, and the back muscles also play a role. The latissimus dorsi. So the hands are falling away, it means the chest muscles are pulling down the hand. Therefore, you have the rotator cuff muscles at the back being underactive, while the chest muscle in front being overactive. Any questions at this point in time?
Have one out of the chat. Condition that we refer to locally as bow-legged, that will have an impact on the actual squat. What would you recommend? Is there an alternative, or do you look for something different when assessing someone who is naturally bow-legged?
Well, you're really coming at my alley because I'm also bow-legged as well. So what you want to do is get the posture right. So one, you want to bring those knees in line with shoulder. And that was first set you up for the posture. That one, that's correct posture. The compensation of pushing out tells you the outside muscles are pulling out because it's a natural posture. So one, foam roll the glutes and the IT band. Foam roll the glutes, IT band, and you want to stretch them because those are the ones that are pulling the legs outward. Now you want to make sure you strengthen the adductor muscle or the muscle on the inside of the leg. You want to strengthen those muscles and that will pull it in and give you a straight line. So that's really, though it is biomechanical, though it is structural, you can get some benefits from doing tightening on the inside and make sure you foam roll the outside and make sure you get some stretching of those glute muscles and IT band.
No more questions.
No more questions. We're moving right along. You can go back to posture. Try to find for it, make sure that you understand what is ideal as you close it down. Because if you don't know what is ideal or what is normal posture for the squat, you will find challenges to know when compensation or what is abnormal. So once again, you go back to what is called anterior view. Look for the knees over the toes, preferably we would say the second and third toe, and that will give you a straight line. From the side view, you want to parallel with the, if you're looking at the knee to the ankle, your shin, and you also look from your fingertips to your hip. If a parallel, that's a parallel you want to get. And then from the rear view or posterior view, what you want to do is make sure the hips are in alignment. And that's really what you're looking at. So, if you have to do compensation, make sure the compensation is going to be, especially if it's heel off the ground, that's telling you that the gastrocs are tight. You don't want to continue to do the compensation by putting the block under the heel. What you want to do is make sure that you stretch the gastroc, and therefore foam roll the gastroc, stretch the gastroc. Posterior chain that will also be involved in that will be your hamstring, especially on the outside, which is called the biceps femoris. By stretching the hamstring, foam rolling, and stretching the hamstring and the calf muscles, you'll be able to put that heel on the ground. Well, that's the end of our session for this evening. It was a bit technical, but so it is. I'm hoping to have a workshop on this sometime where you can come and actually practice the foam rolling and the stretching. Once again, stay fit and stay safe.
I want to thank everyone for being a part of this afternoon session with Coach Humphery. A very knowledgeable coach, as always. A pleasure to have you with us and being one of our presenters.